Hello, beauty bosses. I'm so excited to be here. I'm Olinga Hargreaves, and I've been practicing general dentistry for the last 25 years with my husband, John, in Denver, Colorado. And I never realized once I started facial aesthetics 13 years ago what a trajectory it was going to take my career and what a game changer it was going to be for me, both business-wise and personally. So I'm so excited to be here. Thank you, Sinclair, for the kind invitation to have me here. I've learned so much this whole weekend, so I feel a little like I kind of am cheating you a little bit because I'm taking home more than I'm going to be offering you. This is my little family back at home and my fur baby, Emma. So she's very sassy, as you can tell. Well, in 2011, when I started facial aesthetics, Botox was not a household name yet. Facial aesthetics wasn't really even a coined phrase yet, and dentists were certainly not doing this in their practices. But out of curiosity, I'd heard the buzzword, and I wanted to find out what that was about. And so I went and got a weekend training and came back so excited because I kind of saw the potential in this. And when I approached my husband and said, hey, I want to bring these services into our practice, his first response was, but why? You're a dentist. Why are you going to do with Botox? But as most spouses who are supportive, he kind of humored me and stepped aside and let me take a go at it. So now, this many years later, over the years, the same patient that my husband is trying to convince that needs that dental procedure, who can't afford to get it done, will come in with more money to get her face done or his face done by me. And so I have to tease him sometimes because it's like, now who's laughing all the way to the bank, right? So I soon found out that I love facial aesthetics, and that's really one of the secrets, is that you have to love it, right? It's my passion. I love what I do. I sometimes have to pinch myself in the morning when I get up because I get to go to the office. I get to see some of these patients who are putting their trust in me to do their face. It's not lost on me that they're allowing me to do this. And then they pay me for it, which is like bonus, right? But you do have to love it. And I just want to share with you some of the things that I've learned over the years that I didn't realize I was so judgmental because I thought I already had figured out who would be interested in facial aesthetics in my practice. And I was just going to like offer those people facial aesthetics. But what I didn't realize of how many people under my noses were really interested. And I hope that you get to take away some of these maybe misunderstandings as well and get to go back to your practices and really, truly dive into it and be able to offer all of your patients because you're going to be surprised. We all have heard this weekend how much this industry has grown and what is projected to boom, right, in the next 5 years, which is really exciting, right? That's just, like I said, a bonus for me that I get to be paid. It's not the reason I do it. And it's not astounding that dentists are getting into it because, as you guys know, we have dedicated our whole career and training to this part of the body, right? We know this in and out. We have got major training in anatomy, physiology, pharmacology, pathology of just the head and neck. So, of course, we're going to have lots of knowledge and skill set that we can bring to the table. Plus, we understand that golden proportion that we get to incorporate every day into the mouth, and now we just get to expand that really outside. That's really it. And so it's not that big of a leap to be able to do this. But most importantly, I feel like dentists are so successful at being able to incorporate this in this practice is that we have a built-in patient base that other people have to go build, right? We have it under our noses. And so really, the good news is there's no ceiling. When I kind of started, I thought it was just going to be some injectables here and there and a few procedures. But the limiting factor was me, right? Because I was not open to all the possibilities that was sitting under my thumb that I could apply every single day. So I want to share with you some patients that I brought. Please don't judge the photos because I didn't have Devin's lecture earlier to be able to give you some good before and after photos. So, and by the way, I am faculty with the American Academy of Facial Aesthetics. A couple of years into my journey, I was approached by them to help become a faculty and teach. And so I've traveled the last 11 years all over the country and have helped bring facial aesthetics into a lot of people's practices, and especially dentists have been the biggest group that I have helped train over the years. So if I can do this, you guys can do this. I always say Botox is the gateway drug to facial aesthetics because most of your patients are always going to be starting with this, especially in the glabella area, right? Nobody wants to look angry. As a matter of fact, I have to remind my husband that I'm not always happy with him, that there's times I'm angry and you just can't see it in my face because I can't move it. It's like, I'm angry at you, okay? I can't move it to show you. But this is where everybody wants to get started, which is a super easy thing to get started with. Very good results, very predictable. But don't forget that men want to look just as good. This is actually a friend of mine who gave me permission to use his photo, and we teach together. And 40% of my patients are men. And I find that in my practice, the men tend to kind of want to seek treatment, maybe like in their 50s and 60s, versus women who start a little bit younger. We're a little bit smarter than that, right? So, but don't underestimate men. They want to look good too. And don't estimate the age of what you think those patients are going to be. I've got patients all the way from early 20s that do a little bit of preventative, and my oldest is 88. It's a husband and wife. They come in. They're very savvy, very attractive people, and they want to look good too. I find fillers for dentists, especially AKA me, was a little bit of a push to get started, to kind of transition into. But lip fillers tends to be an easy transition into the face because A, we understand the embryology, it's where we live, and so it's a pretty easy way to get comfortable with the rest of the face, and we can produce some attractive lips, right? They're not gonna look like duck lips or two hot dogs sitting on top of itself, right? And so if you can get really good at being able to do lips, that's, again, an easy transition into the rest of the face. And one of the benefits of it is that because as dentists, we can numb patients. I literally will have patients come in from a couple of states over just to get their lips done by me because I can numb them and keep them comfortable. So don't undervalue the fact that you've got that in your practices. One of the areas that I really didn't see coming was gummy smile. These patients are usually referred to me by my local orthodontists because they get to see this demographics more so than me. But these patients are usually female, between early 20s and early 30s. They have a excessive display of gingiva because either they have an altered passive eruption issue or some kind of skeletal discrepancy. And either way, they don't want to have surgery done. And this is a very easy procedure to be able to incorporate into your dental practices. Such a routine thing. All of these photos are 2 weeks apart. The top photo is the base, and then the next photo below it is 2 weeks apart. And these patients are super happy, and because it's such an easy thing to do, we get to see them on a regular basis, and I find that they can go anywhere from like 3 to 4 months when they first start to now the longest that can go is about 11 months. But they routinely come in and get a quick little Botox treatment done, and then they're happy as a clam. So I quickly realized that not everything is going to be addressed by injectables in my practice because patients were coming in with all these different concerns after they've had some treatments done and they're excited to move on to the next thing. And so I quickly had to start investigating into some energy-based devices. And in 2017, my world and Viora's world collided, and I bought my first V30. And I can tell you that that first year, that machine paid for itself. And because of the fact that Sinclair has got such an amazing marketing and tools to be able to help to get this incorporated into your practice, and you're gonna see some of the cases that I'm gonna show you of how valuable it can be of things that you never even considered was sitting in your practice. This is my mother-in-law. She's my guinea pig. Anytime I do something, she always is the first one to volunteer to do, the service. But she had this scar, and I'm sorry the second photo is a little too bright, but you can see the scar softening with just one ST treatment. And this was the day that I was doing the demo on the V30, so she's the reason I bought the V30, because she was so happy with it. And because my demographics in my practice is about age 65 or 70, she kind of fit that, mold. And so she was so happy with just one treatment that she no longer had to be self-conscious, about that. Before I even purchased my Viora, I had this patient who was going to her 50th high school reunion buy a package to do her neck, because she knew she was going and it was going to take a little bit of treatment sessions. But this is 3 treatments, 1 month apart, and it helped her be able to get a nice result without having to go through surgery. What I didn't see coming was a patient that she was not in a brawl. She had an unexpected oral surgery done, and unfortunately for her, 3 days later, she was flying to Hawaii to go attend a wedding. So she called me the next day and said, hey, is there something that I can do to mask this bruise? I got a little bit of bruising, and you can see this giant hematoma right on the left hand of the screen. And so she came in. I treated it one time with the IPL, and it jump-started, this hemorrhagic, lesion enough to where she actually reported that by the time she got to Hawaii and attended the wedding, it was so faded that she could just put a little bit of makeup on and attend the wedding without being self-conscious. So, bonus, how many of those do we get to see? And as you've heard all weekend, right, combination therapy is where it's at. This is where the patients benefit the most, and obviously we get to benefit as a result, right? So here's a farmer patient of mine, Ed, and his concern was not cosmetic. It was the fact that he's noticed lately that he has to hold his eyebrows up physically to watch TV. And he knew that I was doing this thing called facial aesthetics and wanted to find out, is there something that I could do for him? Because he didn't want to have surgery done. And so this is a series of treatments with ST and some Botox. And it was a great result for him to be able to accomplish his goals, right? One of my famous patients, Sally. Sally, I'll tell you in just a second why she's so famous, because I use her all the time as an example. The day that my front office came and told me that Sally wanted me to do her exam because she wanted to talk to me about facial aesthetics, my first response was, Sally who? Because I knew she was coming, and why would she want to talk to me about facial aesthetics? Because Sally lives in a nursing home, and she comes in a walker. So, I couldn't, and then I thought, I think they misheard what she said. So I kind of hesitantly walk in the room, and lo and behold, Sally's telling me that in her nursing facility, she has been promoted to be in charge of entertainment. And so she sings and plays the piano. And she's noticed that lately, she's having to put a lot of effort into making the sound to project out. And she was wondering if, because of the collapse of what she's seeing in her face, could be the problem, and if so, is there something that I could possibly help her out with? So, mind blown, right? And so this is 2 weeks apart. I did ST around her perioral, V-form in the neck. We did Botox in the glabella, around the eyes, and filler in the mid-face. So 2 weeks apart. I She was super happy, and the reason she's famous in my practice is because she is one of the biggest package buyers and maintaining that she comes in very regularly to maintain this. And this is just an example of, I just wanted to express the fact that, again, when patients buy packages, it allows us the freedom to be able to do the layering of that they need and address all the different concerns. Just like aging is multifactorial, so does our approach have to be. I kind of try to explain it as like layers of the cake, right? If we're only doing one thing, we're only addressing that layer, but not all of it. And so this patient, these photos are 3 months apart. Betsy has had thread lifts in her jowl. We've done ST around the perioral, Botox in the glabella and around the eyes, crow's feet, had filler in the midface and lips. And then we did 3 sessions of PRF and microneedling. And her famous quote is, "Spring is eternal." And again, she buys packages, and she comes in on very regular basis to just maintain this. The biggest question I always get asked whenever I'm lecturing is, how do you get started? And your team is your #1 fan, right? You start with your fans in your office. First of all, your team loves the fact that they get to have stuff done, right? They get to benefit from the things that you're offering. Then the second thing is, this is my executive assistant, Tammy. She's like pretty much the same demographics as my patients. And she gets to be able to express what it is to be on the receiving end of these services and be able to ask questions. So she's always my model. Whenever I want to talk about something, it's like, "Hey, Tammy, come in." And she gets to like model what she had recently done and be able to talk to patients about what it felt like, to what to be expecting. And most importantly, she gets to mitigate a lot of those post-op questions that you're gonna start getting, and she'll be able to say, "Oh yeah, that's perfectly normal. That's exactly what it was like. It's gonna go away," or "Yeah, you're gonna be expecting X, Y, and Z." And so your team is the best people to start with, and your family, because they're gonna be forgiving, right? To get started, to get your timing down, to get all those kinks worked out in terms of being able to incorporate this into your everyday, routine. So we all have heard marketing and promoting your treatment. This was my launch party for my Viora, and Miss Kara is on that lower right corner. She was the lady that came and trained me and helped be able to do some services that day. But it was mostly to remind me of some of the things that I have done that you may want to end up doing in your practice to promote. Is I started collecting Botox vials from the time I started doing Botox, and over the years as I accumulated it, I just started putting them in these glass jars, and now we got glass jars like filled with Botox, empty Botox bottles everywhere in the patient lounge, the front desk, consultation, all the rooms. So when patients come in, if they know what it is, they're like, "Oh, you offer Botox. That's wonderful, because I want to get some done." If they don't know what it is, it's a conversation starter, because they'll ask, "What is this?" And then it gives us the opportunity to be able to tell them that, "Hey, we do Botox." We also found another thing that has been valuable is menu of services. So we started printing menus of what we offer to patients, because if you go to an Italian restaurant, you're not going to order sushi, right? Because it's not on the menu. And so how do patients know what you offer unless you are able to give them something to take home? So all of our new patients get a menu of service. We have it in our practice with all the brochures, and we try to be able to do e-blasts and keep communications open with patients whenever we start offering new services, or we've added something, or if we are having some specials, which I tend not to do too often. But for the sake of time, implementing all these services are super easy to do. As a dentist, I would suggest maybe picking one day that you're not doing dental gymnastics and you've got all the noise going on in your day. Concentrate on being able to perfect the systems for facial aesthetics, and then gradually introduce them as you have timed yourself, you know what it's gonna take from point A to point B, consent form, photos, and all that, and then gradually be able to bring it into your practice. So this is my contact. If anybody wants to, If anybody wants to stay in touch, I'd love to hear from you. If you ever find yourself in the Denver area, let me know, and you're more than welcome to come and see my office. And I want to leave you with one last quote by my favorite, Nelson Mandela, that said, "If it's been done, it's possible." So thank you for everyone.